part one of this video series, we heard strategies that the U.S. Virgin Islands and Alaska health agencies employ to engage and empower communities in supporting the COVID-19 pandemic response. Given the stakeholder engagement is a key component of agency-wide assessment and improvement planning efforts, we asked USVI and Alaska health leaders to revisit pre-pandemic priorities and plans. This ASTO Experts video highlights where health leaders have looked to leverage planning and partnerships in order to maximize public health impact for near and long-term priorities. To begin, we asked Alaska's Chief Medical Officer how strategies from the state health assessment informed and improved the COVID-19 response.
So we built the Healthy Alaskans 2020 initially and then 2030 in partnership with the tribal organizations. So at every level, we had a leader and a co-lead associated with our tribal partners. And so the decisions are what our health metrics goals are, how we were going to do it, how we're going to communicate it are all structurally built together so that we structurally have that two-way information and that crosstalk between us. We saw early on in the pandemic when we didn't structurally build that in, sometimes we were stepping on each other's toes and we didn't see where other resources were being shipped. And we didn't have, even though we had built relationships, they weren't structurally a part of the conversation. So for example, our vaccine allocation at every single level, we have a tribal and a non-tribal state lead at every single allocation. So everything from pharmacy to payment to communication and messaging to our leads. And that, honestly, in the last 2 weeks has been a game changer. We have had to pivot and shift so many times with how much vaccine we may or may not be getting with all sorts of different allocations and dosing. And having that structural kind of combination between us and our tribal partners has allowed us to pivot much more quickly. But it has just really emphasized the need to have community engagement structurally built into your response so that you're able to respond and pivot as new challenges come up that you may not have expected. So when we were looking at a COVID response and trying to understand what would be our alert levels, census and borough area don't work well for us. We have some that are so small that statistically it's not significant. So we have built our alert levels based actually on our behavioral health 1115 waivers, as we call it, our behavioral health zones. And there were regions that had at least 20,000 people in them. And we looked at where people tended to get care and kind of chunked the state in between these kind of community behavioral health regions. And that's where we talk about these alert levels because that's where people normally move. And so we're really building within that, looking forward at how to have regular kind of built-in engagement with communities and how to build up these behavioral health regions as almost kind of independent community regions that are thinking about the health and well-being overall. I think for all of us, COVID has just highlighted the importance of prevention and how much we save and how much better we do from prevention early on. And so how can we build on that to continue to move towards prevention? I think the other big thing is just IT. I think it's impressive at how much work everyone has been doing along the IT framework as we have all these tests coming in and different cases and what that looks like. And so I'm really hoping that moving forward, we will have a better, more streamlined IT infrastructure to provide information with what's happening to the community, to the state and back, to be able to provide real-time availability to respond, improved community relationships that really look at where people really do work, live, travel, and play to be able to create wellness in the communities. I think that one of the things that we've really seen particularly in the length of this response is that FEMA and our kind of federal response are really meant for a disaster and being ready right then. But this ongoing prolonged and really being able to move towards prevention has been a big challenge. So how can we change emergency response to being able to really be much more about system capacity, regardless of the challenge that happens? And so how do we think both prevention and response at the same moment? So our team's really been spending a lot of time thinking about that. We've also been thinking a lot about health equity and the ways that we get resources to different communities or different people. And so I think it's been really important for us to kind of break down those communities to see what they need, get their feedback on what's working and what's not working to be able to respond. And again, I think at the end of the day, when a small community, really any community can really own their health challenges, they can contain it. And really that empowerment is just critical for COVID and well beyond COVID. And that is a lot of our focus moving forward, the ways that we can empower communities to contain it, to own it, and empowering them to keep their communities healthy and well.
So I can start by saying the Department of Health has actually acquired a culture of performance improvement. And along comes that, well, what do we do? And in terms of a strategic plan, that's one of the first things that I really wanted to do is look at what we had historically. And if we didn't have anything, how can we develop a strategic plan? And we have actually very close to completing our strategic plan. So the essence of a strategic plan, of course, comes with our key performance indicators. So the government of the Virgin Islands, along with our Office of Management and Budget, has key performance indicators that allowed us the ability to grow. So you have your strategic plan, you have your key performance indicators, and then you look at what you want to do for the community. And of course, health initiatives such as COVID is entwined into our community health plan.
You know, the fact that we started working with everyone back in the very beginning of the year before COVID became a problem helped us to identify some of our strengths, some of our weaknesses, and we knew exactly what we had to work on. So the work began there. But even though we were in the middle of the COVID pandemic, we never lost sight of our strategic plan, our CHA, and developing the framework for our community health improvement plan, because being in the pandemic, in the state of emergency, we knew that we had to improve to be able to be in a better position, because this is not going to be the last time that we're faced with an emergency like a pandemic, and we wanted to be better prepared.
If anything that COVID has done, it has actually brought health back up into the open limelight as to really the importance of what health does for our community. I have to say that Governor Bryan has also been a pretty good advocate for some of the efforts that we put in place at the Department of Health, including the CHA. He spoke about our community health assessment in one of the huddles that we had with our cabinet members. And I have since shared the CHA with my colleagues so that they too can read what the data is showing and how we can actually not just improve in health, but how health impacts each and one of their entities and their agencies, and what they can do also to improve the numbers that they actually look at on a daily basis. So we know we have to try to combat and manage the effects of COVID-19. But at the same time, we have a charge. We have key performance indicators. We have regulatory, we have grants that we have to run. We have patients that we have to see. We have staff members that we have to care for. Those things cannot actually be ignored. And I think that we've actually taken the channel that, okay, for the first maybe 3 months, we focus on COVID. But what do we do now? We have to make sure that we allow each staff members to know that their importance, and not only in COVID, but what do they need to do to keep going within each division. It kind of gives us that strength that we need. And I think that we are actually on a good trajectory because of that. We don't know how long COVID is going to be around. So we're balancing that. I have to tell you that we have a meeting coming up soon through the governor's office that's going to speak more so on what we need to do for coming forward after COVID. And like I said to them, when define after COVID, you know, it could be 2022. And so we're looking at during COVID and post-COVID, but it's a community, the business, they really want to get together because they're eager to start to go and flourish. So we're trying to balance that act a little bit. Health is important, but we're going to try to help you survive as much as we can.
Thank you to USVI and Alaska for sharing these insights. You can check out additional ASTO experts resources and part 1 of this series on ASTO's YouTube page.